Hi, and welcome to the New Zealand Veterinary Association webinar series, Disbudding and Dehorning of Cattle. My name is Ash Kewen. I'm the Veterinary Manager for Large Animals here at the NZVA in Wellington. I'm hosting this 4-part webinar series, which is designed to assist veterinarians as they help their farming clients fulfil their obligations under the regulations for disbudding and dehorning of cattle. In this, the second presentation in this webinar series, I'm going to talk you through the NZVA veterinary resources which relate to disbudding and dehorning of cattle. These are the policy, the local anaesthetic authorisation guideline, the disbudding training and assessment guide, supplementary guideline on dehorning of beef calves, and a standard operating procedure for the disbudding of calves. The NZVA policy, titled Disbudding and Dehorning of Cattle, acknowledges that disbudding and dehorning are necessary practices to manage the risks posed by horned cattle. However, as painful procedures, effective and appropriate analgesia is essential. Literature provides support to suggest amputation dehorning is more painful than cautery disbudding. The NZVA therefore emphasises that cautery disbudding is the preferred procedure carried out when calves are 2 to 6 weeks of age where possible. If this is not practically achievable in the management system for that farm, for example in extensive beef operations where calves are unlikely to be mustered prior to 6 weeks of age, then use of polled genetics should be prioritised and cattle should have horn tissue removed as soon as is practicable. Effective and appropriately placed local anaesthetic will be required by law as of the 1st of October 2019. This anaesthetic must be effective throughout the procedure, which means the use of caustic paste is unlikely to comply because the duration of the paste is likely to exceed the duration of activity of the local anaesthetic. The NZVA does not advise the use of caustic paste for any animal due to the risk of chemical burns to the skin, eyes and mouth of the individual animal treated with the paste, as well as any other animals in contact with the treated animal. The NZVA suggests that veterinarians should consider the use of other products which have been demonstrated to reduce pain and distress associated with disbudding and dehorning. This includes sedation and long-acting analgesia. The second document is a local anaesthetic authorisation guideline. This is a new document which has been created in response to member request and is designed to assist veterinarians to fulfil their obligations under the Agricultural Compounds and Veterinary Medicines Act, or ACVM, and the Veterinary Council of New Zealand's Code of Professional Conduct. When they assist non-veterinary persons to safely and effectively disbud in accordance with the Animal Welfare Act and Regulation 57, disbudding of cattle beasts in the Animal Welfare Care and Procedures Regulations 2018. The guideline gives an overview of the options that veterinarians have to support calf welfare through provision of local anaesthetic for calf disbudding, and it provides further information on the key points related to veterinary authorisation and veterinary operating instructions, or VOI. The guideline also provides ready-to-use templates which ensure veterinarians are capturing the necessary information within their authorisation or VOI to fulfil their own professional obligations under both the ACVM Act and the Veterinary Council's Code of Professional Conduct. Veterinarians may use these templates as a guide to ensure that their own documentation is capturing all the necessary information. It's also advisable to read through the ACVM notice requirements for authorising veterinarians and the guidance document Veterinary Operating Instructions. Both of these are available on the website, MPI website. And it's also advisable to read the Veterinary Council's Code of Professional Conduct, which again is available on the Veterinary Council of New Zealand's website. It's worth noting that authorisation of restricted veterinary medicines is the domain of registered veterinarians with a current annual practicing certificate. Therefore, we are uniquely positioned to enhance animal welfare through provision of local anaesthetic to allow disbudding and dehorning. However, should a veterinarian have any doubt regarding the capability or the competence of any person who will be using the product, an authorisation must not be issued. Veterinarians control the authorisation process, and they should not feel pressured to issue an authorisation where they don't feel it's the appropriate choice. A veterinarian may also revoke an authorisation or VOI at any time. In instances where veterinarians are concerned about the handling of any product authorised, which includes using that product for any procedure other than what it's been authorised for, or concerns about the conduct of any person using the product, then they should consider revoking the authorisation and informing the relevant regulatory authority if that's appropriate. Please note that although the local anaesthetic authorisation guideline does use terminology related to disbudding, as this is the preferred procedure that we should be advocating, the information is also applicable to dehorning of beef calves, and veterinarians may use this resource to create an equivalent authorisation or VOI for dehorning of beef calves if that's appropriate. Before issuing any veterinary authorisation, the authorising veterinarian must confirm that the person who will administer the RVM understands and is able to competently carry out the instructions for the use, and they must also provide information to allow the person using the product to meet any animal welfare requirements. So this should involve some training and assessment of competency. To assist with this, a disbudding training and assessment guide has been created for NZVA members, which can be used as a framework to train others to competently disbud calves. While the training and assessment of most importance relates to the effectiveness of the local anaesthetic, the NZVA believes that veterinarians should also consider preparation, animal handling, the disbudding procedure itself, and the aftercare. Greater competence across all aspects of the procedure are likely to improve the welfare of the animals. The document is a full training guide example with content, drug recording templates, and an assessment template. Veterinarians may use this document as is, or may choose to create their own document using the checklist at the end as a reference. Veterinarians are not required to follow the guide verbatim. Other products and techniques which have demonstrated efficacy can be used as an alternative to those which are described within the guide. All training and assessment should be documented and should be recorded against the client's record along with the authorisation. Records of any veterinary authorisation must be kept for 5 years. As for the local anaesthetic authorisation guideline, this disbudding training guide relates to disbudding as it is the preferred procedure. However, veterinarians may choose to adapt the content of this resource to train for dehorning. Veterinarians may exercise their judgment as to whether a client has sufficient competence to support the authorisation for dehorning. In response to feedback from members, however, a supplementary guidance has been prepared specifically related to dehorning of beef calves. Beef calves in extensive systems are often brought in for routine husbandry procedures at an age where, if not polled, then the horn bud has become attached to the underlying bone. It's therefore no longer free floating, and removal of that horn tissue is dehorning, not disbudding, as per the definitions within regulations 57 and 58. As discussed in the first webinar of the series, the wording within both regulation 57 and 58 is very similar, which is a cattle beast must not be dehorned unless, throughout the procedure, it is under the influence of an appropriately placed and effective local anaesthetic. A person who dehorns a cattle beast must be experienced with or trained in the correct use of the method being used. The regulation does not specify which methods are appropriate, and veterinarians are expected to exercise discretion regarding which methods are appropriate for non-veterinarians to use. Cattle of any age may be dehorned in a manner which complies with these regulations, and the regulation does not preclude use of any particular technique, provided that all personnel are trained and competent in that selected technique. The NZVA advice is that beef calves should have horn tissue removed as soon as practical to avoid having to dehorn them or tip them as adult cattle. It's also worth noting that cattle over 6 months months of age are already required by law to have an appropriately placed and effective local anaesthetic for castration by any method in accordance with Regulation 53. As discussed earlier, the legal requirements and professional standards obligations are identical for dehorning or disbudding. Veterinarians may use the resources which refer to disbudding and adjust the content to account for the differences in the procedure. Veterinarians must exercise professional judgment if they're asked to issue local anaesthetic for non-veterinarians to dehorn adult cattle. Dehorning in adult cattle is a significant procedure which enters the frontal sinuses and has the potential to cause significant negative health and welfare outcomes. It's also typically undertaken less regularly and with fewer animals. The potential for an additional nerve supply also complicates the procedure. For these reasons, the New Zealand Veterinary Association recommends that dehorning of adult cattle should only be performed by veterinarians, as sufficient competency is going to be difficult to obtain and maintain for non-veterinarians. That's the reason why we haven't created a specific training document for dehorning. The final resource that's available to NZVA members is a standard operating procedure for the disbudding of calves. This document is intended for veterinarians to use when they're considering how to develop their own SOP for their own practice, and it can also be used as a training guide for veterinary staff within the practice. It's not intended for the training of clients. There's more detail on sedation and other procedures which are going to be less relevant for non-veterinary people. As for the training guide described earlier, veterinarians may use alternative products and techniques to what's been described in that SOP. That concludes the second webinar in the series on disbudding and dehorning of cattle, where we've discussed the 5 NZVA resource documents which relate to disbudding and dehorning cattle, and these are available for NZVA members on our website. In the next webinar, we will go into further detail on the authorisation of local anaesthetic for disbudding and dehorning. In the meantime, if you've got any questions or feedback relating to this webinar series, to disbudding or dehorning generally, or any other matters, feel free to get in touch with us via email or via phone. That's all from me. Thanks for joining me, and I'll see you next time.